Thanks, everybody. I'm a ring-in, really. I'm presenting on behalf of Elizabeth Kalidas, who's our Queensland manager, who couldn't make it along today, but I'm very happy to talk about Grow. Just to give a quick overview of where we are now in Queensland. Firstly, I guess Grow is a national organisation. We were very fortunate to be... we've been here in Queensland for quite some time. We've been first funded in 1975, and I think we're probably one of the first mental health services funded in Queensland. In this round of tendering, we were funded for $550,000, which is a small increase on our previous funding, and we've been funded to provide statewide mutual help services. Currently, we've got 26 Grow groups operating in Queensland, and we've got what we call three regions: Brisbane, South, North, and North Queensland. So up from Cairns, Townsville, Gympie, Bundaberg, those areas. And the goal is to have 31 Grow groups established by 2015. Grow was established by people with a mental illness back in the 50s. We've been operating for quite some time, nearly coming up to our 60th year. And that was at a time when there was no real sense of recovery from mental illness, and there was an incredible underlying overwhelming stigma around mental illness, and if you became unwell, you got locked up in an institution or locked up in the family home, I think. Our founding members thought that by working together they could overcome some of their problems. They'd had experiences with AA and saw some good application of mutual help there, but felt as though they needed something extra focusing and targeting mental health. And so that was the beginning of Grow groups. Right. This is just a small extract from a personal story, or a testimony we call it, from one of our members. Stories are a very important part of what happens in Grow groups. The groups are very structured, which is a good thing, I think, or some people don't necessarily like it, but it does mean that people, when they come to a Grow group, they know exactly what to expect. Volunteers lead our groups, and there's a strong focus on leadership in Grow. I've been with Grow for about 4 years, and one of the most startling things has always been for me that in the 50s they talked about leadership for people with a mental illness. So not only trying to get over that stigma, but actually talking about people becoming leaders. And leaders in their own direction and managing their own health. There's a strong push on people taking responsibility for their own good mental health, but an acknowledgement that sometimes that's something that you can't do on your own. And so we talk about being that you alone can do it, but you can't do it alone, and that's how the groups generally work. So within the group's members, one of the elements of Grow group is where people talk about their recovery and their use of the Grow program, and that provides a lot of hope for people and an incentive. People generally talk about when they come to a Grow group that they feel very much at home. A lot of people come to Grow. There's a strong focus on community development and friendship and community connection. And we do that first of all within the group. So you can see here, she's talking about her Grow friends. People try and support each other, not just in the group but outside of the group as well. So if there's a problem that you're struggling with, people will call during the week to see how you're going with that particular issue, or perhaps provide some practical support, come along with you to your doctor, or help take you shopping, or catch the bus with you if that's something that you want a hand with. The challenges that people bring to Grow groups are very ordinary. I was talking to one of our members the other day, and she said it was a great sense of relief for her to have a group that she could come to where she could talk about ordinary things. She said she was overwhelmed by what she described as the big problems in her life, maybe getting a job or, getting the sort of accommodation that she wanted. But she said by coming to a grow group and talking about the ordinary challenges that were getting in her way, that the other things seemed to be not so significant, and she could work on them and, I guess, manage those larger challenges in more bite-sized chunks. Where are we up to? So one of the important, so helping each other is an important element of Grow, as I've said. People use their experiences to help each other, and it also helps people feel very valued. In talking about leadership, we start off talking about leadership, taking control of your own life. But there are opportunities for leadership all the way through Grow. It's still a consumer-driven organisation. The groups run autonomously, and the staff support the volunteers who manage those groups. So people develop a whole range of skills to lead the groups, but before that they might also volunteer to help out with social activities. We have newsletter teams and a whole lot. So the whole organisation is actually run with the support of volunteers, but it's a very meaningful approach in helping people develop skills, practice social skills, develop more friendships, and feel more comfortable in themselves, and get that sense that that they can do tasks and accomplish things, and it generally leads to a good recovery from mental illness. There's quite a lot of research into Grow. It's been around for a long time. We've just recently done a literature review as well, which we'll publish very soon, looking at how mutual help and peer support works. We had a look at recovery models, robust recovery models, and the expected outcomes of those, and then use that to identify the evidence around peer support and mutual help. And so we'll be able to provide that to people very soon. One of the important things we wanted to talk about today was how we work alongside other organisations. We currently work in partnership with quite a number of organisations. Just to mention a few in Queensland, MIFQ, we work down the hub. We've got a couple of groups operating down there. Clubhouse and Toowoomba, we work alongside within a partnership, Centacare and up in Cairns, and PIR in Rockhampton, all providing a varying range of support for us. Generally, what happens when we develop up a partnership is it's really about a venue. The Grow groups meet in ordinary places, community halls. One of the features of Grow is that it's what's generally considered an informal service. So there's no intake process. People can just come. There's no fee. It's very confidential. So you only have to identify yourself well by your first name if that's what you want to do, and you disclose as much as you feel you want to disclose. So it's a very accessible service. But in terms of the partnerships, we'd be very happy to talk to anybody that's interested in setting up a Grow group alongside their services. Venue, support for the group, referral to the group, and assistance with maintaining the group is something that we'd be happy to do with you. This is the first principle of Grow. Grow is full of principles and wisdoms. One of the things that the founders did when they started Grow was write down the things that they found helpful, and most of those writings have been put in a book that we call the Blue Book that we use in groups. Researchers describe it as like a cognitive therapy program for lay people, I guess. People have a problem. They get what we call a practical task, and they also get some wisdom to go along with it. This is the first thing that we talk about with people is personal value. It's probably one of the biggest things that people struggle with mental health. When people come to a group for the first time, this is the thing that we work on most, is that everybody is valuable and that everyone has a place in the community. That's a big challenge, I think, for a lot of people. And once we get past that, then the work seems to come. So that's it. Thanks.